In a dramatic turn of events, CDC Director Susan Monarez is standing her ground, refusing to step down even as other officials choose to resign. This situation has sparked significant discussion and controversy within the Centers for Disease Control and Prevention, CDC, and beyond. Reports indicate that several officials have recently left the CDC, raising questions about the agency's stability and direction. Panelists Tom Bevan, Josh Kraushaar, and Yemisi Egbiwole recently discussed these resignations on Special Report, highlighting the implications of these changes during a critical time for public health. Monarez, a seasoned scientist with a long history in government service, has been thrust into the spotlight after the Department of Health and Human Services, HHS, announced her removal from the CDC, just weeks after her confirmation. Her attorneys, Mark Zaid and Abby Lowell, have publicly stated that Monarez has neither resigned nor been officially fired, asserting that she is committed to her role and the scientific integrity of the CDC. In a statement shared on social media, her legal team accused HHS and Secretary Robert F. Kennedy, Jr. of politicizing public health, which they argue jeopardizes the well-being of millions of Americans. They emphasize that Monarez prioritized public safety over political pressures, stating, when CDC Director Susan Monarez refused to rubber-stamp unscientific, reckless directives and fire dedicated health experts, she chose protecting the public over serving a political agenda. The controversy deepens as sources within the CDC, who requested anonymity, revealed that HHS leaders, including Kennedy, pressured Monarez to retract approvals for certain COVID-19 vaccines. When she hesitated to comply, administration officials allegedly informed her that she would need to resign or face termination. In a bold move, Monarez sought the support of Senator Bill Cassidy, the chairman of the Senate's top health committee, which reportedly further incensed Kennedy. In response to inquiries, an HHS spokesperson confirmed Monarez's removal, thanking her for her service and expressing confidence in the remaining CDC team. The White House echoed this sentiment, stating that Monarez's refusal to align with the president's health agenda led to her termination. White House spokesman Kush Desai remarked, as her attorney's statement makes abundantly clear, Susan Monarez is not aligned with the president's agenda of making America healthy again. Monarez was appointed by the Trump administration after the initial nominee, Dave Weldon, withdrew due to concerns about Senate confirmation. She was confirmed as the first-ever Senate-approved CDC director in late July, marking a significant shift in the agency's history. Notably, she is also the first CDC director in over 70 years without a medical degree, although she holds a PhD in microbiology and immunology. Before her appointment, Monarez held various roles in federal government, including positions at the White House's Office of Science and Technology Policy and the National Security Council. Her biography highlights her contributions to enhancing the nation's biomedical innovation capabilities and improving pandemic preparedness. Following the announcement of Monarez's departure, at least 3 other high-ranking officials at the CDC also resigned, including Dimitri Daskalakis, the director of the National Center for Immunization and Respiratory Diseases, and Dr. Daniel Jernigan, the director of the National Centers for Emerging and Zoonotic Infectious Diseases. Daskalakis publicly shared his resignation letter, citing concerns about the administration's approach to public health, particularly regarding vaccine policies that he believes endanger vulnerable populations. This unfolding situation raises critical questions about the future of the CDC and its role in public health. Are we witnessing a shift in how health agencies operate under political pressure? What does this mean for the integrity of scientific guidance in health policy? We invite you to share your thoughts and opinions in the comments below. Do you agree with Monarez's stance, or do you believe the administration's approach is justified?